The more you exercise, the more you need to do to recover. I'm Doc John from Mobility Doc, and I want to talk to you about muscle and joint hygiene. And just like there is oral hygiene or dental hygiene, like you can eat good foods that are good for you, but you still need to do things like brush your teeth and floss. It's the same idea with exercise. Just because you're exercising doesn't mean you can get away with not stretching, foam rolling, doing a good dynamic warm-up, nutrition, sleep, and things like that. And what I want to go over with you today is what is the best way to go about performing adequate muscle and joint recovery or muscle and joint hygiene to support your active lifestyle. Muscle and joint hygiene refers to the proactive maintenance of your muscle and joints or your body. It is the necessary activity, the active activity that you need to take part in to be able to keep doing the things that you want to do. Exercise is stress, it is physical and emotional stress put onto your body, and we need to do things to help us to be able to continue to train the next day or 2 days later without starting to fall apart. These activities promote flexibility, decrease stiffness, decrease the rate of injury, increase our performance and our ability to continue to train harder and train more often. So there are 6 components to good muscle and joint hygiene. I'm sure you can fit other things in there, but what I went ahead and did was I put the 6 most supported by scientific literature and evidence for you, so that way there is a good starting point. Feel free to comment and share other things that you've come up with or that you've found to be helpful. So one of my personal favorites that is an active form of recovery is self-myofascial release, or SMR work for short. Things like muscle scraping, foam rolling, self-massage. It's those activities where you are trying to improve the pliability and stretch in your connective tissue, in your muscles, in those layers between your skin and your muscles, so that way you can continue to contract and relax in the fullest way possible. Self-myofascial release has been shown to decrease delayed onset muscle soreness and improve range of motion and blood flow throughout your body, so that way you can heal faster and do more. Number 2 would be stretching. Now, stretching can be both dynamic and static, and it has been shown that progressing from static to something more dynamic is more beneficial than simply just laying there, touching your toes for as long as possible. If you want to create more positive change, incorporate movement into your stretching. And we personally like putting a good dynamic stretch routine as part of your mobility routine before you lift or exercise or compete, so that way you are confident that you have as little friction as possible as you go through a range of motion. Now, mobility exercises can be any exercise that's purpose in that moment is meant to improve your range of motion under load. Mobility is stability, it is flexibility, and it is strength through a range of motion. So some of those old-timey kind of bent presses and Turkish get-ups, the exercises that require you to move through a range of motion as freely as possible while trying to control your posture and that movement, your center of gravity, those are excellent for training your body to be flexible, stable, and strong when you need it. You can insert mobility exercises in as part of any good warm-up, as part of any good daily recovery routine. You don't need to go crazy. Remember, the point is not the weight of the implement or the exercise that you're doing. It is about being able to go through as big of a range of motion with as much control as possible. Weight is only meant to increase the difficulty of you being able to control the range of motion. It's not a hypertrophy bodybuilding exercise. Hydration is key. We included this in here because it is very actionable and easy to do. You just need to drink more fluids, more water. Hydration is important for contributing to the lubrication of your muscle and joints to make sure that you don't become stiff and you don't become injured more easily. And ultimately too, if you're dehydrated, we all know that you're not going to perform well. So as part of muscle and joint hygiene, there's nutrition, and nutrition is extremely important for maintaining the cellular integrity, the structural integrity of our joints, especially as we continue to age and be as active as possible throughout the entire duration of our life. Nutrition's a little bit beyond the scope of this video right now, but it is important to keep in mind and to continue to explore further what nutrition you absolutely must be taking or putting into your body to make sure that you have healthy joints and muscles. And last but certainly not least, and sort of part of this entire idea, is a proper warm-up and cool down. Now, it goes without saying that we need to warm up, but a lot of us will cheat the cool down, and the cool down is a great opportunity to get ahead of the soreness, the fatigue, the ache, and the pain that we could feel after we work out, exercise, or compete. So make sure you do something active. It shouldn't just be laying there stretching. There should be some kind of light jog or movement-based practice at the end of whatever you just did to make sure that you don't hurt the next day or 2 days later. Now remember, the reason why we do muscle and joint hygiene work is not just because it is quote unquote good for your body and soul. It is because it is meant to help you to perform better. It is meant to help you to prevent getting injured, to be able to output as good as you can, and to take advantage of all that hard work you're doing. This mobility work and recovery work should be part of your training plan, not an accessory that you just get to when you can, because without it, you're not going to be able to take advantage of all the great things you're trying to do for yourself. So yes, you can improve athleticism, you can decrease pain and stiffness, you can improve your recovery time, you can improve your output, and you can even prevent chronic pain and stiffness. So this balance between exercise and recovery is part of what improves performance and also promotes long-term health. Now, the amount of recovery work that you do is in line typically with the intensity and duration of the amount of exercise you're doing. So the more you do exercise-wise, the more recovery work you need to do. The professional athletes, just because they are at the highest level of what they're doing and as efficient as possible, doesn't mean they can get away with doing less recovery work. The more you do, the more you need to recover. And we're all different. Genetics plays a big factor into this. We all know somebody who does the bare minimum of recovery and remains healthy and uninjured and continues to perform well, and good for them, right? But sometimes that's not just us. Like, sometimes we just need to treat ourselves like the individual we are, and we need to do the things we need to do to be able to do the things we want to do. So what I want from you to take from this video is that exercise is just the start of being healthy. You need to also do other things to make sure you're recovering, because with exercise can come pain, can come soreness. We don't exercise just so that way we don't feel pain. We exercise so that way we can live as long as possible and be as active as possible throughout that entire lifetime. So make sure that you are practicing good muscle and joint hygiene to get the most out of your active lifestyle.